The Ebola outbreak in the Democratic Republic of Congo is rapidly worsening, with suspected cases now crossing 1,000. The World Health Organization has warned that the real spread of the virus could be far wider, even as neighboring countries tighten border controls. The Central African country has reported more than 1,000 suspected Ebola cases since the latest outbreak was declared on May 15th. According to the Congolese Health Ministry, the country has recorded 121 confirmed cases and 238 suspected deaths so far. The World Health Organization says the actual spread may be much larger. Uganda has also confirmed 5 cases and 1 death linked to the outbreak. WHO Director General Tedros Adhanom Ghebreyesus is currently in Congo to oversee response efforts.
The kind of support we're asking, the amount of support we're asking is still not received. It's a third of what we asked we're getting in terms of funding. And I use this opportunity actually to ask the international community to increase their support so the health workers get the supplies, the protective measures they need, and they are protected. Because without health workers, it would be very difficult then to help patients. So the health workers should help themselves before helping others.
This is the 17th recorded Ebola outbreak in the country of more than 100 million people. Over 15,000 people in Africa have died due to this disease over the past 50 years. The deadliest outbreak in the DRC claimed nearly 2,300 lives out of 3,500 cases between 2018 and 2020. The current outbreak is caused by the Bundibugyo strain of the Ebola virus. The virus spreads through close contact with bodily fluids such as blood, sweat, vomit, and feces of infected patients. Healthcare workers and family members caring for patients are at the highest risk. The WHO says several possible vaccines and therapies have been identified, but they can only be tested through clinical trials and may take months to develop. The Africa CDC says it hopes vaccines and medicines for the Bundibugyo strain could be ready by the end of the year.
We're also working with different institutions and partners to expedite the clinical trials of the candidate vaccines and treatments. Of course, that will not be available. It will take some months, but we'll try to expedite so we have the tools or the technology at hand.
The response to the current outbreak is being complicated by 2 major challenges: the lack of approved treatment for the Bundibugyo strain and the ongoing conflict in eastern Congo. Fighting involving the Rwanda-backed M23 rebel group has disrupted healthcare access and slowed containment efforts. WHO Chief Tedros has appealed to armed groups to stop the fighting so health workers can safely respond to the crisis.
One is the conflict, the security challenges, and that's why in my letter today I asked for a ceasefire, giving a message to the warring parties. And the other problem is displacement. People are displaced because of conflict. People were displaced hundreds of thousands and newly displaced around 100,000 I think in the past few months. And that makes it very difficult to contain the outbreak. And the other, of course, is the food insecurity you see in the province and other neighboring provinces that makes it difficult also. And then, of course, mistrust, we can see it. People are really worried. They're not understanding what's happening, and I think that could also affect the response.
Meanwhile, neighboring countries are tightening restrictions. Uganda has suspended direct flights and halted border crossings with Congo, while Rwanda has imposed quarantine rules and Kenya has stepped up screening at entry points. Health officials fear the combination of conflict, delayed vaccine development, and weak healthcare access could make containing the outbreak far more difficult in the weeks ahead.